I'm going to turn it over to Rhonda Barkus.
All right, thank you, Kim. Well, welcome everybody, and we are so excited that you have signed up to be a part of this first learning collaborative. One of the things that we have found with this Small Rural Hospital Transition Project is that some of the hospitals moving forward had strategy maps and balanced scorecards, and we all know that it's getting more and more important for all hospitals, especially rural hospitals, to be able to demonstrate value. And so knowing that some hospitals that we've been working with have a strategy map and balanced scorecard, and many others were saying, no, we don't have that, or we're not really quite sure how to create that, or we have it, but we really need to update it to make it more relevant to what's going on in healthcare today. So we decided to actually offer this learning collaborative for the first time to you all. So we did this last year with some of the SRHT hospitals that we were supporting with on-site projects. And we decided, you know, why don't we open it up to other SRHT hospitals or SRHT eligible hospitals who might be interested in actually going through this process with us. And so there were 9 hospitals that chose to participate, and so we are so excited to have you all as part of this first group. We are going to be, as Kim said, we are going to be recording these calls because after the 5th call, we're actually going to pull all of this together into a package that will include all of the resources and the five calls, so that we can offer that to other hospitals, both SRHT eligible hospitals and other hospitals that are not eligible. But we'll have that on our website and in our toolkit so that other hospitals could actually go through the same process. So you all are really leading the way in helping other hospitals figure out how to do this. So in just a moment, we are going to do introductions. You know, the goal for today is really to get to know each other because we're going to be working very closely with each other over the next 5 months. These calls, as Kim said, are very interactive. This is not going to be a webinar where we just present information. We will always have a teaching piece as part of the call, but then the bigger piece, and I think the piece that's most valuable and really richest, is all of the interaction that you all will have with each other, sharing ideas, sharing some of the barriers, brainstorming ways to overcome some of the barriers. So please do keep that in mind as you're calling in for these meetings, that it's really it's going to be as rich as it is interactive. So let's see, just to go ahead and get started. So probably many of you are very familiar with us at the center. You know, we are a National Rural Health Resource Center. We're a nonprofit organization that really has worked for years to help sustain and improve healthcare in rural communities. We work with hospitals across the country. And some of you have already participated in some of the projects that we have done. But we really focus on these 5 core areas: the transition to value and population health, collaboration and partnership, performance improvement, health information technology, and workforce. And so as you can imagine, this learning collaborative series that really will focus on strategy map and creating balanced scorecards and showing value just plays in very nicely with these 5 core areas. So these are the locations of the hospitals that are participating in this series of calls. And so again, I'm so excited. I think that probably shared with you all, we have 9 hospitals from 9 different states. Some of you all we have worked with before, some of you we have not. So we're so excited about this opportunity to get to know everybody a little bit more and to hear what's going on in your hospital, and having this opportunity to collaborate with each other. So today in just a moment, I'm going to have you guys introduce yourselves. We'll talk a little bit more about the goal of these calls, give you an overview to the call so you'll know what to expect in the next 5 or the next 4 calls. We'll talk a little bit about some of the tools that will be available to you and resources so that you will be able to work through the strategy map and balanced scorecard. And then at the end, we'll talk a little bit about our suggestions on what you can do in preparation for that next learning collaborative so that it will lead right into our next content piece and our discussion. So I wanted to go ahead and pause there and have you guys introduce yourselves if you would, and then after that I'll have the rest of the SHRT team introduce themselves. I think it'd be, maybe I'll just go down the line, and you will need to hit *2 to unmute your line. And so I think I'm just going to start Richardson Medical Center in Louisiana. It looks like James Barrett, CEO. If you're on the call, if you or another organization or another representative from that hospital, if you would hit *2 to unmute your line. And what I'm going to ask you to do is to share a little bit about your hospital, your community, and whether or not you already have a strategy map and balanced scorecard. If you do, or you needing to update it, kind of what that status is, and then a little bit about any of the major issues that you are encountering at this point. And so we really probably want to take about 2 or 3 minutes for each hospital so that you can really give us a little bit of an overview so we can get to know you. So I will be quiet now and leave James Barrett, are you on the call with Richardson Medical Center? And it's *2 to unmute your line. Okay, we will come back in just a minute. Let's see, how about Antoine, I see that you are on there, and you are from Washington County Regional Medical Center in Georgia. If you'll hit *2 to unmute your line, tell us a little bit about you, your community, your hospital, the status of your strategy map and balanced scorecard, and then any particular challenges you guys are facing right now.
Hello, how are you doing today? So this is Antoine Poitras. I'm the CEO of Washington County Medical Center, and I have in the room with me my management team. I have Dave Flanders, who's the COO and CIO, and I have Heidi Coffey, who's my CNO. I'm drawing a mind blank on it. Our CNO. So our goal is that we are a small 59-bed hospital in rural Georgia with a 60-bed nursing home. So we do have some struggles that probably are not probably similar to a number of hospitals in small areas. So our goal in this collaborative is to be able to develop our strategic plan or map out our strategic pathways over the next 5 to 7 years, so we can continue to make improvements to stay in existence over that time frame. We do think we have to now make very smart decisions. We don't have the luxury of having a lot of misses as it relates to decisions in which we make in a strategic nature for this area. So that's what we're hoping to learn, is a little bit more about the process and a little bit about creating those strategic goals and mapping point of view. Our biggest struggle is that we're in a rural area, and we have a number of out-migration issues. So our biggest struggle is around out-migration and around public perception that small hospitals do not provide good quality care. So with that, our biggest challenges are trying to convince the public to stop the out-migration, bringing providers into the community to stem the out-migration, and just overall competing against much larger hospitals and national chains that are within probably a 60-mile radius of our current hospital. So we've made a lot of progress over the last 2 years in improving the financial stability of the hospital, but we still have a long path to travel in order to get where we would like to be. So we are looking at major items such as some type of partnership with a larger tertiary healthcare facility, but that partnership has to be beneficial to our facility. So we spend a lot of time and resources on that partnership, or working on that partnership, and resources working to address our primary issue, which is the out-migration issues.
Okay. All right. Well, Antoine, thank you. And so it sounds like you have some ideas already of the kinds of things that are going to need to be on your strategy map. So that's perfect. You know, and as you were talking about the out-migration, I've often heard some of the consultants we work with talk about the importance of hospitals telling their story so that the community really knows what a jewel they have right there in their own community, and that bigger's not always better. And so already, I guess in my mind, things are thoughts are going off as far as potential thoughts for you guys around your strategy map. So good. It sounds like you have a direction around that. I wanted to double check. So you said that you were needing to really develop a strategic path. Do you all have a strategy map and balance scorecard now, or will this be the first time? Are you updating? Where are you guys in that?
Well, we actually have one. I mean, we have what we call our Vision 2020 plan, in which we have mapped out some of the key indicators or key elements that we want to achieve, and we use that as our guide. We want to develop something that's a little bit more detailed than our current plan. And so, from a learning standpoint, I think me and the executive team just needs additional information, additional knowledge on how to expand off of the plan that we have today.
Okay. All right. Perfect. All right. Well, thank you, Antoine. And also, I'm really glad to hear that you've got your leadership team in the room with you, because as you know, this is not a process that one person alone can carry. And certainly more heads are always better when it comes to creating strategy. So thank you. We're glad that you've joined us, and we haven't worked with you before, so I'm excited to get to know you guys more.
Okay, thank you.
All right. So I'll go on down the line. Brenda, I know that you are with Reeves County Hospital in Texas, and so if you would hit star 2 to unmute your line and introduce yourself, let us know about your status with your strategy, and then what are the major issues you're facing.
Hello, this is Brenda McKinney. I am the CEO at Reeves County Hospital District in Pecos, Texas. We are a rural community, far west Texas. We have a lot going on in our community. We are going through a huge oil and gas boom. We've had some in the past, but nothing like what we're facing right now. It's been very, very good for our community and very good for the hospital district. But in all honesty, not only the hospital district, but the whole community has not been able to keep up. So we have lots of challenges facing us right now. Lots of, not so good things that come with the good things, but we're trying to handle all those. We went through a strategic planning process a couple of years ago, and we do have a map. We follow it, but we haven't really gone back to it like on a quarterly basis like we probably should have. Kind of drifted away because we have so much going on. We're in the process of building a brand new hospital. We're building apartments because we need staff, and there's no place in our community for people to live, new people coming in. There's man camps going up left and right in every direction of our community. There's RV parks that have popped up in every direction of our community. There's RVs in the back of people's houses. It's just overwhelming. So, like I said, lots of good things, exciting things for our county, but it's been a very big struggle. For example, our ER visits have pretty much doubled. We have 2 major interstates that we're right off one of the major interstates and 30 miles from the other. So we have a lot of trauma with that and the oil field coming through our ER. So we have lots of exciting things happening, but lots of challenges that we're facing right now.
Wow, that is sounds pretty overwhelming, but some huge growth and huge opportunities, as you said, that often come with challenges as well. So it sounds like this is a perfect time to revisit your strategy and to update that, because it sounds like you guys are probably in a different place than you were 2 years ago when you originally did that.
Yes, our oil and gas boom had started when we did our strategic plan, and it we were at a low for a little bit, and it's just peaked right back up. So yeah, we really need to. We're doing some stuff that we had mapped out. One of the things we had was trying to build this healthcare complex, and from that we obtained the land to build a new hospital, and we're moving forward on that as fast as we can, because we can't expand in the facility we are in right now. And so yeah, we probably do need to go back and update that plan that we have and continue to move forward with some of the things on it, but we are trying to use it. But honestly, we have not visited it in several months, and probably at least 6 or 7 months, because we just can't seem to keep up with everything else that's happening.
Yeah, absolutely. All right. Well, welcome. I'm glad you're here. It sounds like you're in the perfect place at the perfect time.
Ma'am, thank you for having me.
Oh, absolutely. All right. Let's see. We've got Lori McMillan from Mercy Tishomingo Hospital in Oklahoma. And thank you. You sent in a picture. We were asking for folks to send pictures of their hospital or of them or of their community, so we could put a little bit of a face to a name or to a community. So star 2 to unmute and introduce yourself.
Hi, I'm Lori McMillan, and I'm the CEO here at Mercy Hospital in Tishomingo. We are a 25-bed critical access hospital running a census around 5, a mix of mostly swing bed, but and some acute. And we have a ED and that. But our building, some of our challenges really is our building is quite old, and Mercy actually came in to this building when it was going under in 2008 and took over the management of it. And so it had previously been a county hospital and was not, a lot of money was not put into it in terms of maintaining the facility. So we're in a capital fundraising campaign right now to build a new building. And so I just started here in April, and as near as I can tell, there has not been a organized strategy. So that's one of the goals that I've had, is to get a plan and figure out what we can do with the limited resources we have in this building. We can't do any construction to it. So what services are we possibly missing that we might be able to provide? We have a strong telemedicine program for our med-surg and swing bed patients, and then with local mid-level providers. And then we also have the support. We're within 35 to 40 miles of 2 other larger Mercy hospitals that do kind of help support us for our swing beds in particular. But we just need to, I think we need to work on, where we can grow our business, and also managing our staffing levels. We have a lot of challenges with, when the census is low, being at core staff, but not being able to support, for that not being the best staffing for us financially. So really looking at how we can improve that. We did get recognized this last year as a top 20 critical access hospital in quality for Chartis. So I think that's a good, a good stepping point for us. But I think there's also some other quality measures and things that we need to work on and improve. So that's kind of where we are.
Okay. All right. Good. Well, and again, Lori, it sounds like there's some good things going on that that you all have the opportunity to tell your story a little bit more in the community. But okay.
Yeah.
Yes. Well, thank you for joining us. Okay. Let's see. I know we've got Tammy. I know that you were on the call. Tammy Stevens with Madison County Memorial Hospital in Florida, and I'm excited to see you on the call, Tammy. It's been a while since we've all worked together, so if you'd like to introduce yourself.
Yes, ma'am. Thank you. Hello, I'm Tammy Stevens, the CEO of Madison County Memorial Hospital. We're located in Madison, Florida, which is also in Madison County. With me today is Cindy Coulter, our Chief Nursing Officer, and Lori Evans, our Foundation Director that serves as our Public Relations Marketing Person for Hospital and the Foundation Board. Our CFO wanted to be here, and he may come in during the call, but Patrick McGee is not able to be here right now, and our other senior manager, Cindy Burnett, is not able to be with us. We built a replacement hospital through a USDA 40-year loan, and we moved into our new build in August 2014. We have 25 private rooms. Our average census is around 14. Today we have 18. We see about an average of 9,500 ER patients annually. Our county population is around 19,500. We are one of only 4 Florida counties designated by the USDA RD as a persistent poverty county. We were designated as the poorest county in the entire state of Florida in 2018 by the U.S. Census Bureau. There are 67 counties in the state of Florida. Our county health rankings is around 65. We have an affiliation agreement with the Florida State University College of Medicine for student and resident training with our CMO, and they provide a general surgeon for our endoscopy program. We have also an affiliation agreement with Capital Regional Medical Center for a telestroke and a telecardiology program. We have a thriving swing bed program. One of our senior managers here, our Chief Nursing Officer, she's a yellow and green belt certification. Our ER director has yellow belt for the Lean Six Sigma certifications, and the radiology director, Chief Nursing Officer, and the nurse manager also are involved in team steps. We do patient safety huddles, leadership rounds. We have, we're the member of the Florida Hospital Association, so we work closely with them through what they call the HEN project. So it's a quality project that we work with them to improve the quality that we provide. And currently our CNO and nurse manager have completed to the Quality Fellowship Program through the Florida Hospital Association. We have, let's see, I wanted to share too that we have 97 full-time employees. We have, but with the part-time, full-time, and the PRN staff, we have a total of 156 employees. FTEs run around 91.94. We are currently working towards our Vision 2030 project within our community, so I know we're going to learn a lot through that process. And I partnered with the local health department to conduct the Community Health Needs Assessment, which was completed towards the end of 2017. And we have a strategic plan in place that was a 3-year, 2017 to 2020. So we're going to start preparing for the next 3 to 5 years. We have a lot of challenges, obviously, with all that being said. And basically the USDA annual loan payment is probably one of our greatest challenges. And staffing is always a challenge. We just recently lost our quality manager and our financial analyst and business office manager. So trying to replace those key positions are difficult in our location. The pool of applicants for licensed professional staff and people with billing and business office experience is difficult to find. We have some challenges with our medical staff as well. Basically, physicians going from a full-time practice hours to less than part-time, and then some other challenges that we face with that. With all that being said, we look forward to working with you all on the program, and hopefully we will be able to position our hospital for financial success and sustainability. Thank you.
Sure, absolutely. Well, again, thank you, and welcome, Tammy, and I'm glad that you included your team in this as well. And it sounds like you guys have certainly a lot of strengths to draw on, and then some ideas, though, for your strategy map of moving forward in the future. So good. It sounds like folks are in a good place to get started, even if you don't have a past strategy map and balanced scorecard. Sounds like it's pretty clear on some of the needs that will need to be addressed in that. I did want to take a moment and see if anybody else is on the line that maybe I'm not seeing in the participant box. And it starts you to unmute. Bridget, I know from White Mountain Regional, is planning to join us today. Bridget, I don't know if you're on the call.
Yes, hi. Thank you. Gregory Wass, our CEO, was unable to be here today. So we have in the room with us myself, I'm the Director of Quality Assurance and Compliance, our CNO, Sammy Finch, our CFO, Larry Terrell, and several of our managers from the hospital. Greg felt it was important that all the management staff participate in these sessions. We are currently at the end of our last strategic plan and getting ready to develop a new strategic plan, so the timing of this is very good. We are a 21-bed critical access hospital located in the poorest county in Arizona, Apache County, also a persistent poverty county designation. We have a rural health clinic, which we've just gained that designation in the last year. We have some of the same challenges that other people have voiced. Some out-migration, not because of the perception in the community, because the community here really rallies around the hospital as much as they can, but because of our lack of services that we're able to offer. We do have a ER, a swing bed program, med-surg, and ancillary services, but we have a lot of challenges with recruiting providers. We're currently in need of providers in our rural health clinic, and so that's probably one of our biggest challenges right now. Of course, financial sustainability is a challenge for us, and I think our goal, and Larry, Sammy, chime in if you want, but our goal is to make sure that we can remain financially stable so that we can not only continue to operate in the community, but we really need to look at growing our service line. We just completed our community health needs assessment, and so we're looking at options of what can we do to bring more services into the community. We're looking at a telemedicine program. Currently we don't participate in any or offer a telemedicine program, so we're examining that. And just really looking for options to grow our services and offer more to our community members, because they want it, they support us, and we really want to help grow our programs. What else would you like to share, Sammy?
This is Sammy, and the only thing I would add is that one of our biggest goals is that we want to keep as many of our community members right here in this community to offer the services here and not have them have to have the expense and the frustration of having to go somewhere else for those services. So that's one of the things we're really working on.
Larry, do you want to?
Well, other than the fact that we're a tourist area, you're more than welcome to come and visit us. So in the summer months we have our highest volume, but in the winter months our volumes definitely go down substantially. So if we don't make any money in the summer, we essentially sustain losses in the winter months, which in the last couple of years has made up for it. But this year, it's we have a fire season this last summer, so we didn't have all the tourists that we normally have. We had severe fire restrictions, so our volume wasn't very good during the summer. Hopefully, we have snow right now, so hopefully we won't have that issue come this summer. We're in the mountains, not in the firebox of Phoenix. We're 4 hours from Phoenix, about 7,000 feet in the mountains. So it's a very beautiful area, but it causes recruitment of physicians and nurses is very difficult, and that's one of the major challenges we have right now.
One thing else I'd like to add to is that we have a very wonderful swing bed program here, and we have a great group of managers that really excel, and we're getting very close to increasing our services in our surgery department, and we're pretty excited about that. So those are some of the great things that we're doing too.
All right. Well, welcome. And again, I know that we've worked with you all before, and I remember one of my colleagues talking about how beautiful it is where you all are. But I'm glad that Greg did decide to include managers, because again, when you're thinking about strategy, it is so helpful to have different levels of leadership involved in that. So that, because, usually when people are involved at the beginning in the planning, their folks are much more invested in the outcome. So I'm very glad that all of you guys are involved. Are you all on Adobe Connect by any chance? Can you see our screen?
Mm-hmm. Yes, we can.
Okay, just checking. All right. So I just want to check, anybody else on the call that maybe I'm not aware of? Nope. Okay. All right. Well, we are going to go ahead and get started then with the a little more overview for the next 4 calls. And again, welcome everybody. We are very excited about this. And as I was listening to you, the other thing I was thinking about is what a wonderful opportunity this is for you all to network and reach out to each other, because my guess is some of the strengths of some of the hospitals are exactly in line with what another hospital needs. So I really hope that you guys will think about reaching out to each other and saying, hey, you're doing this, how did you do that? And really use each other as the best experts. So, all right, Kim, will you go ahead and move those polls, please? And so this is the team that'll be working with you over this next 4 calls. There's Terry Hill. He'll introduce himself in just a moment, and we'll be speaking a little bit. He's our subject matter expert. And by the way, he is also available throughout this entire series for coaching at any point. And so just know that he is always a resource for you all. If between calls you have questions or you need some guidance or you want to just talk through something, he's your man to go to. I'll be leading the calls and can provide additional resources as well. And then you can see Kim, who kicked us off, and she'll be hosting the calls, and she'll be continuing to communicate with you all about the future calls. You should already have on your Outlook calendars the request for these next 4 calls, but those are the dates and the specific topics for each one. One of the things that's important to realize is that each call builds on the one before it. And so, we start off with a kickoff, and then each call just will increase kind of your awareness and your experience and give you practice on different pieces of the strategy map and balance scorecard, so that by the end of the 5 calls, you hopefully will have at least a pretty strong draft for those things if you've gone through the exercises that are available to you between each call. But here you can see the learning objectives for the overall 5 calls. So again, of course, it's to use the templates that have been developed to develop your strategy map balance scorecard, to be able to develop metrics for those, to learn a little bit about how how other hospitals, shared hospitals have used those consultation reports to supplement their strategic plans. And we also have the toolkit for transitioning to value-based systems, which is another great resource that will help you in thinking about some of the actions and some of the items that you could actually do to move towards your strategy. So those are the objectives. To give you an overview of the next 4 calls, next call, which is our second call, we are going to be talking a little bit more about strategies, and you all will have a chance to talk more specifically about what kinds of thoughts you are really starting to hone in on that you want to include in your strategy map. We are going to start talking about how to initiate the development of that, and then we are going to be talking about the preparation for Learning Collaborative 3. Learning Collaborative 3 is going to be about really finalizing that strategy map draft, putting more meat to the bones of it. Also, we'll be talking about how to use a systems approach to plan and operationalize your key transition strategies, and then we will be preparing to take the strategy map and begin to initiate the balanced scorecard development. So Learning Collaborative 4 is going to be around building that balanced scorecard, using the top strategic themes from your strategy map to really build those measures. We'll talk about some of the common measures that are used in many organizations. We'll give you lots of ideas to that. Talk a little bit about strategies and action steps that will help move your scores forward and to really impact those metrics. Then our last call will be bringing all of it together to talk about the status and any last thoughts you all have around needs as far as the implementation of your strategy map and balanced scorecard. And just as important, we're also going to be talking about how you can really communicate those things internally and externally so that you're getting buy-in from your staff, from your board, and from your community. And then how to demonstrate value over the long-term success. All right, so that is the outline for the next 4 calls. At this point, I'm going to hand it over to Terry Hill, who's going to talk a little bit about the need to demonstrate value, and he'll introduce himself, although I know many of you already know Terry. Terry?
Thank you very much, Rhonda, and good afternoon, everyone. I've actually had the pleasure of working in both White Mountain and Madison, and those are both really very lovely communities. And I've also worked throughout the United States, worked in every state for the last 20, 30 years. So our programs, besides this program, the Small Rural Hospital Transition Program, include another program that's doing intensive work with rural hospitals in the Mississippi Delta region, and that incorporates a lot of other elements. Many of the things you talked about already: telehealth, looking at community engagement, et cetera, et cetera. Also, we've started an MBA program here for rural health leaders, and I teach in that class as well. So what I'm going to do very briefly here is just kind of lay out where we know the payment system and where the healthcare industry is moving, because it's truly moving in this direction of the triple aim and value. And part of the reason is just the crisis that is currently facing, particularly our Medicare program, with the dramatic influx of patients moving into Medicare, and also the very fact that for a great many Americans, healthcare has become unaffordable. For example, if you get diabetes right now, 40% of the people, 40% of the people that get cancer basically are bankrupt within 2 years. We also have healthcare costs and financial crises with our hospitals as well. And currently 46% of our rural hospitals are running negative operating margins. So if things were going great for rural hospitals, this might be a little more threatening than it is. But the whole payment movement is moving in this direction. Virtually all of our physicians are now on a value-based formula. Approximately a quarter of our rural hospitals are now in accountable care organizations or some other value-based model. And you're going to keep hearing over and over again this whole issue of value. We take value very seriously, and we intend to provide maximum value to you folks. If you can take the time to be on these calls and work with us, we pretty much guarantee that you'll get value out of this. With the balanced scorecard and the strategy map, we've been doing this for almost 20 years, so I can just tell you, as the former CEO here and now the senior advisor, this has been very valuable for us, and we believe that it's particularly valuable for our rural hospitals moving forward. Now, the Agency for Healthcare Research and Quality has talked about value in that regard, but basically the formula is improve quality and patient satisfaction relative to reduce utilization and cost. This whole concept of reduced utilization can come off as pretty threatening. And in the old payment system, which probably most of us are still in, reduced utilization might very well translate in reduced financial success. But the new payment system itself is moving towards, we have seen year after year a steady decline in hospital occupancy. We expect that to continue, and consequently it's going to be important to be able to make this transition. That's what the transition in our title basically is talking about, over into these new payment systems. And in these new payment systems, we're going to have to document our quality. So it's going to have to be more than just the financial bottom line. We're going to have to show quality outcomes, and we're going to have to prepare for this movement into the value models. And that preparation is going to include kind of some investments in terms of infrastructure, training, and staff. It's going to include movement into new processes that are going to be more efficient. And it's going to mean we're going to have many more partners than we might have had in the past. So that's the good news, including a lot of community partners we can talk about later. And finally, it can very well mean that it's going to culminate in financial success. So we realize that every rural hospital, at least the ones that I'm aware of, are financially fragile, and we take all of this into account as we work with you kind of moving forward. So what is that demonstration of value? What are the key indicators here that you're going to be measured on in the future? And a lot of it has to do with population health, and you might have heard this term over and over again. But in essence, it's just the shift where we're going to be rewarded for keeping people healthy. We're going to be rewarded for keeping populations healthy, for doing chronic illness management. And I'm talking about payment now that is available here. For example, our wellness visits are now able to be paid for, and they're paid for in accountable care organizations, but they're also paid for you folks. And I would really encourage you to think about doing wellness visits because they're financially feasible, you can get paid for them, etc. And you're starting in to learn this whole concept of how to work in population health. Patient experience is also part of the formula for how we're going to get paid here. And so focusing in on one of the strategies might very well be to have the best possible HCAHPS scores or patient satisfaction. Our per capita cost, we are cheaper per Medicare patient than urban centers. They may not realize that, but the data is really pretty clear. And we have an advantage, and we can be successful here. And what we've seen is that the 400 or so rural hospitals that have been in these value-based models have shown greater savings and greater quality than their urban counterparts. This is really possible to do. We're not suggesting everybody jumping into an ACO. We are suggesting be ready and start to include in your strategies what we think is going to be this inevitable movement. The strategy map will help communicate that. The balanced scorecard will help document your progress moving forward. Rural relevant measures, which we've listed here, include HCAHPS scores, as indicated, mortality rates, total cost per member per month, and the member basically in an ACO are Medicare recipients. And what we've seen is that the cost per Medicare recipient becomes the new indicator of whether, you know, in a value-based model, we're going to get paid bonuses or whether we might be in some ways penalized here. So it's a good thing to think about that, the cost per member. And another one is emergency department utilization rates and costs. So what we see is that the early feedback from those 400 hospitals is saying emergency department overutilization is a big problem. It's costing us money per member. It is we also are indicating, I heard out-migration mentioned several times. We're finding the out-migration is hurting us in both of our models, both in the current payment system and in our future payment system, and there are ways to deal with that as well. You know, we're suggesting that there are various strategies here that can be used. I'm not going to go into all of those, but this is roughly based on a comprehensive systems approach, which we're going to talk about later, but it's about leadership, workforce, results, impact and outcome, operations and processes, information management, which is another huge perspective here, patients, partners in the community, leadership, and then strategic planning as well. So we're going to be dealing with these as we're moving forward. The last thing I'll say is within the center and our subsidiary corporation, Rural Health Innovations, we have a ton of resources in virtually all those areas, including finances. And if you folks want to, besides the balanced scorecards and strategy map, feel free to reach out to us if you have an individual problem in finances or any of the strategies that you're going to be doing here, including out-migration. We'll try to find resources for you or offer advice or anything else I can do. So with that, Rhonda, I will turn it back to either you or I guess Kim is going to talk about resources.
Great. Thanks so much, Terry. Hello, everyone. My name is Kim Norden, and I'm just going to talk to you a little bit about these resources that we'll be using throughout the Learning Collaborative this year. As Terry and Rhonda talked about before, the Value-Based Summit template guide will become sort of like your Bible throughout this process. And this guide was developed after our 2017 Value-Based Summit, which we brought together just a ton of subject matter experts in the field, and they really wrote these, or they developed these templates for hospitals. So the strategy map template and the balanced scorecard template are both provided in Word documents. So they're very, very easy to use and adopt, and you can make changes to what's in there. They include examples, and they're really easy to communicate with your board of directors or your medical staff and frontline staff. They are designed to be easy to implement at the department levels or any other levels that support your organization-wide initiatives. Let's see here. So this is what the value-based strategic planning guide looks like, and I suggest that you download it and take a look at it, page through it. You'll be using it and Rhonda will talk to you in a minute about some, well, we're not going to call it homework, but some things that you can do to prepare for the Second Learning Collaborative. So you'll be using this value-based strategic planning guide as well as the Word templates for the balanced scorecard and strategy map. Rhonda, do you want to talk about how hospitals can prepare for the Second Learning Collaborative?
Yeah, thank you, Kim. So, and Terry, thank you for setting the stage around value. I think it's helpful to begin to get those wheels greased and get folks thinking about different ways to think about value, that there's a piece of it that's financial, but there are other important pieces too, and those will be included in certainly the strategy map and the balanced scorecard. And, you know, I was just thinking, therefore, the word balance. So it's not just about the financial piece of it, but it really is balanced across the board in a lot of different areas. So Kim was sharing with you all about the resource guide, and as she said, that is going to be the guide that is going to walk you through this process. And she mentioned that those two documents are in Word form, and the reason we did that is because, you know, certainly we don't want everybody to have to be starting from scratch when it comes to creating a strategy map and balanced scorecard. So as you begin to look through those, you will see that there are already a lot of examples and suggestions. So you're able to kind of delete the ones that you don't want to use. You can add new ones, but at least you have a starting place so that you're not starting with just a blank screen like, oh my gosh, what do I do now? But it really gives you something to at least react to decide, okay, does this fit? And maybe it fits partially, but I want to change the strategy map piece just a bit, or I want to change the scorecard piece a bit, but it makes it a little bit easier. And as Kim said, that this was developed by some of our CEOs in other hospitals that have done this before. We've worked with the consultants to do this. Some of our representatives from the state offices of rural health. So there were a lot of folks who work in this day in and day out that were involved in creating that. So in preparation then for Learning Collaborative 2, the main goal for this next piece is for you all to begin to pull together information that you have to begin to think about what kinds of items need to be as part of our strategy map. A couple of you have mentioned some recent CHNAs that you did. That's a perfect place to start, looking at your current strategies. I've got a couple tools on the next slide I'll show you that you can use to do some assessments to figure out if anything comes to the top there. But just, you know, and maybe the team brainstorming. So really looking at measurable data that you have, resources, surveys, things like that, that begin to give you information about what things might be most important to put on your strategy map. And knowing that there are a lot of important things that could go on there, so it's really about coming back to what's most important that's going to help to move your hospital where you want it to be in the future. So if you have a strategy map already, go ahead and look at it, compare it to some of those other assessments that I just mentioned or the CHNA to see what needs to be updated. Go ahead and download those strategy map template, and then the Summit Guide on pages 20 and 21, that will help you to begin to initiate that development. All right, so a little bit about the strategy map focus then. So these are the two tools that we have on our website that you are more than welcome to use, and we encourage you to use them as you're beginning to think about what you want to include in your strategy. One is the self-assessment for transition planning. Again, we have the links here. You could pop right on there, and it's a very quick assessment that helps for you to look at where you currently are in different areas like measurement and community involvement and quality. So it gives you a good breakdown of where you're already pretty strong and where you might need to focus. So some of you have done this before. If you've ever applied for the SHRT project, then you would already be familiar with that transition planning tool. Another tool that we have on our website is the Population Health Readiness Assessment. Again, can be accessed through the website, and it just gives you some feedback about your readiness moving towards population health, which Terry had mentioned earlier is such a key piece of looking at value. So one of the suggestions there, you don't have to do it, but one of the suggestions would be just to have several people take those assessments, and then you can look at your results together, compare and contrast, see what comes to the top, see if there's some areas where people saw things differently. So again, being able to have a really nice discussion to start honing in on what are those few items that we need to start looking at. And then as you download that strategy map template, that will begin to walk you through that thinking about the different categories and what might be some areas to focus on within those next categories. So when we come back in our next call, which is in February, we will talk a little bit, we'll have you guys again talk about what kinds of assessments did you use? Did you use the CHNAs? How did you come up with your ideas for your strategy map? Just beginning to talk about your initial thoughts for those next steps. So you won't have to dive down deep into the strategy map yet. We'll do that, and we'll talk through that content next time. But really, between now and then, the whole focus would be to begin to prepare and get a clearer picture on what might be your top strategy areas. All right. Well, I am going to pause there. I see Kim has put a poll back up on the slide deck, and it's just asking about, now that we've talked a little bit about your knowledge of using strategy map and balance scorecard, just if you have any difference in opinion where you are now. Also, I'll pause for a moment. If anybody has any questions in preparation for next time, you can hit *2 to unmute your line, and or you can also go ahead and put your questions in the chat box. Any questions, or Terry, is there anything else that you would like to say before we wrap this up and as we're waiting for questions?
No, only that, you know, we appreciate you guys. I mean, a good part of our entire mission is to support rural hospitals across the United States. And we have so many resources here and so many good people to help you. Please don't hesitate to reach out, whether it's the balance scorecard or the strategy map, both of which we think are terrific, or if it's any other problem you might have as well. That's about all I'll close with, Rhonda.
Okay, thanks, Terry. And I see there's a question from Lori. If multiple people fill out the assessments online, would we be able to get facility-specific results, or should we just tabulate locally? So you could actually do either way. You will get results individually from the things that you fill out. So each person will get a result, and then you can bring those together and have discussion. Or if you want to talk through as a group what you are thinking you would answer for those items, and then you could have some discussion and come up with an agreed upon response for each of the items. You could put that into the assessment, and then you would just get one report for the entire hospital in that way. So you could actually do it either way. It's a good question. Any other questions? All right. Well, thank you again, and please remember, if at any point you guys have questions, concerns, need some specific guidance around any of this, you've got